Happy New Year, everyone. We are going to talk about clinics. Many of you have either shadowed or have toured Temple Podiatry before, so you might know the whole structure around our clinics. The outline of Temple Podiatry's clinic is that there are 4 modules. The first module is surgery, second module is radiology, third module is K room, which stands for comfort and care with a K, and the last module is the wound care. So majority of the patients going to the surgery module will be those who are maybe there for a consultation for surgery, or those patients are actually post-op patients who are coming back to get further x-rays and further workups and see how things are healing up. For the radiology department, you're not going to have any clinicians there. You're just going to be with a radio tech who's going to be helping you radiograph any patient who needs to get their x-rays done. For the wound care, patients going in, they might have ulcers that needs to be looked at. Lastly is the comfort and care. Most of the patients there are sort of miscellaneous. Majority of them are there for diabetic foot care, but also the usual nail debridements, callus debridement. I've actually been in all 4 modules. If I was to rank these modules, the worst would be radiology, because I absolutely have no patient encounter. I just x-ray patients. If I have time, I'll read patients' notes just to see what they're in for and like why are they needing the x-rays. The second module that I hate the most would be surgery module. It's not that I hate surgery, it's because of the clinicians that I was paired up with during my surgery module rotation. I'll just give you guys like an example. There was a time when this professor was kind of in a rush, and at the time, I was just starting out, I was very slow, and the professor or clinician passive aggressively was talking down on me, saying, if you don't hurry up, you're gonna have to buy this patient dinner. And the clinician was telling me to do this and that, and I just had no idea what to do. I think the best thing to do at that scenario would be just to help give me a hand, but instead the clinician took out their anger on me because I was being slow and I was taking up their time. Specifically for the surgery module, a lot of the residents are going to be in that module. So if a clinician is not having a good day, they're going to transfer that negative energy to the residents. And the residents are also seeing the patients along with us, and if they're not happy, they're going to pass their anger on to us. I have experienced that personally, and it wasn't a good experience. It made me question whether or not I belong in podiatry, whether or not I was smart enough. I would rather much prefer someone saying, hey, it's going to be all right, you're just starting, it's all going to get better from here. Instead, I was criticized by this resident by them saying, you guys should know this. How come you don't know it? At the time, I wish they were more understanding of the whole clinic situation, because we aren't seeing as many patients and we're not getting exposed to as many scenarios as possible, so we can be aware of all these different situations. Moving up the ranks, I would actually rank comfort and care room and wound care modules the best out of all 4. When I was working in those modules, I actually felt the calmest and a sense of confidence that I knew what I was doing. The clinicians there especially, they are very nice, they are very caring, they accommodate to the students because they know what we're going through. So it is here that I want to give a special shout out to Dr. Khan. He by far is one of the best clinicians. Every day he's very consistent with the way he treats his students, and he's always proactive, or rather excited to teach his students new things. And he wouldn't really judge you if you get something wrong. He's gonna correct you, and that's it. And he won't really make a big deal out of it. It's very encouraging. Like, how many of you would actually want people shouting in your face and telling you, how can you not know this? Why are you doing this wrong? In a way saying, are you stupid or something? How many of you would actually want to hear that every single day? One of his philosophy is that, you see it, you do it, and you teach others. That's one of his philosophies. And of the 2 heel injections that I've got to do so far, it's because he let me do them and he had confidence in me to do them. Dr. Khan is actually one of those clinicians that if you don't know something, he's gonna tell you right at that moment when that information is so fresh in your mind. Unlike other clinicians who will actually sometimes tell you, hey, you know, go home, do your research, and tell me tomorrow. There is no bias. He treats all his students the same. Now, that's been the clinic life for me. So right now, how the clinic schedule works is that every month you're paired up with a different clinician. So next month, I won't be with Dr. Khan. I will be with someone else. Their schedule has not been released, but it will soon be. In the past, how it would work was that students were assigned to particular modules, and then they would, you know, see patients as usual, but they won't be assigned to a particular clinician. You will be working simultaneously with all the clinicians in that particular module. I have a feeling that after the pandemic, that's how things are going to be. A pet peeve of mine is that there are things that aren't consistent in terms of like billing. Every clinician has their own way of charting notes and billing for procedures. The way you bill for a clinician might not be the same for the other clinician. And I wish there was more consistency in that. I think I have covered everything in regards to clinical rotation. Currently, I'm driving aimlessly. I don't even know where I'm at right now. But hopefully everything I said makes sense when I go back to edit this. And my throat is like really dry right now, but I'll see you guys around.